Are we supposed to say?
Mike check.
Hi. Hello.
Yes, hello, audience.
Come on, she's here. Oh, okay. Welcome to In the Community with Dantes. And I have some great hosts here today. I have some great people here today. And our Father, I thank you for bringing us here today. Let us get home safe and sound with no hurt, harm, or danger. No unseen danger that we are in right now, Lord. Let us all get back to our safe destinations today, on this day, and every day. Amen.
Amen.
And we would like we would like to introduce our guests that are on our show today, and we're talking about the opioid epidemic. Yeah, opioid epidemic.
Epidemic.
Yes.
We would like to welcome our two guests, Mr. Jason Joyce, Clinical Director of Recovery Resources, and Ms. Sharita Hooven, our Case Manager, giving the parental perspective.
Yes.
Thank you for having
Welcome,
me.
Jason.
Thank you.
All right.
Question number one. Tim.
Well, before we do that, Jason, do you mind telling us a little bit
Sure.
about what you do for Recovery Resources?
Sure. So, like I said, my name is Jason Joyce. I'm the Senior Director of Clinical Services at Recovery Resources. I oversee all the clinical services, so all of our mental health and substance use groups, individual sessions. I'm not a psychiatrist, but I do administratively oversee psychiatry. And then lastly, our prevention services, where we go out in the community and to the schools to help teach people about mental health and substance use disorders.
All right.
Back to Tim.
Our first question is, how are prescription drugs classified? And the second half of that would be, what is an opioid?
So an opioid is a depressant. So what it does is it helps numb the body from pain. And when used in high doses, it can cause euphoria or extreme pleasure. The drugs were started as a way to help people with pain. So they started out in a positive way with a positive message. Most of opiums, or I should say most opioids are derived from the poppy seed plant, which contains opium. And there might be some other names you've heard of, heroin, Oxycontin, fentanyl. Those are all different substances and medications that derive from the one plant of opiates. So when we talk about opiates, we're talking about that whole umbrella of drugs that derive from the poppy seed plant for opiates.
What kind of first-hand knowledge do you have about opioids, if any?
So my background is as a licensed professional counselor and also a licensed independent chemical dependency counselor. So my experience with opiates is helping treat people with opiate addiction through the whole continuum, so either mild, moderate, or severe. At Recovery Resources, we primarily work with people who have pretty significant opiate use disorders, and when they come to us, they come for help trying to either get off those substances or find some way to lessen the pain associated with the addiction with those substances.
What should the public know about the epidemic?
From a parent perspective.
Well, just from a perspective, I think just for the community.
Mm-hmm.
Well, I think first and foremost, stigma and fear. Those are the two big reasons why people don't bring up why they have an addiction issue, and they don't talk about it with other people. Mm-hmm. So stigma and fear are big things. And when you look at the statistics, right, so Ohio, they are third right now in the nation for opiate overdoses. Just within Cuyahoga County alone, we had, and I got the numbers this morning, 822 overdose deaths this past year.
Wow.
Wow, that's shocking.
It's crazy, right? And 477 of those are from this powerful opiate called fentanyl, which is, was started out as a very strong, powerful synthetic opiate, and then it was made to help people, but now they're using it to people are dying from it because if they take just a small amount, they don't know how much they're taking, and then they can die from it. So, in terms of our crisis, our epidemic, that's what we're speaking to when we say that these are, we're losing more lives to opiate overdose than we are to handguns. We're losing more lives than some of these big things, more than suicides. So more than a lot of the kind of the mental health and substance use crises that we've had in the past, opiates are very significant. And the reason why people don't get help is because they're embarrassed. We believe this is a medical condition. So this is something that, might be something to do with your genetics, maybe what you've been exposed to, what you've tried. But, we view this as something that it's a medical disorder. It's something you have to manage, similar to diabetes, in that, it's a lifelong condition that you need to manage and kind of get the right treatment for, or else you'll kind of go down that same path again and slip up. So I think to answer what we love getting out in the community is that people need treatment. Treatment works and people can recover, and that stigma and fear, it's just something that we want people to seek treatment for and help to get over. So only 1 in 9 people who need a substance use treatment actually get it. So the vast majority of people, and I'm sure you guys can think of it kind of in your own lives, people that you've known might have struggled with addiction, or that you've run into that drink too much or use drugs or things like that. And most likely they haven't been able to get the help that they need.
So now, as a parent, I do have, not my oldest anymore, but both my children were involved in sports. I know that a lot of times with sports comes injuries, and I know that some addiction is associated with maybe pain medication.
It is, yeah.
So how, I guess it's sort of a twofold question, but how as a parent or as someone who supports someone on pain medication can look out for something like that? 'Cause I wouldn't know.
That's the scary part. Cause
that was going to be our next question on the list. What are the signs to look for if you think you know someone who's addicted?
Mm-hmm. It's a great question. With opiates, they're tricky because not everyone, obviously, who takes an opiate gets addicted, right? So we maybe have been prescribed, a pain medication when something hurt or something like that before. So not everybody that takes it does get addicted. So that's sort of one of the scary parts and the hard part, because you don't know necessarily if it's going to happen to you or not.
Right.
So as a parent, the first thing you want to look out for is, are they using the medication as prescribed? And if they are, what are they kind of doing? And then if you get a prescription, say for a month, and the pain subsides, are you still using it? Are they looking at new ways to get it? So those are the things you want to look for. Those are kind of more the early stages in terms of forming an addiction or having some issue with a substance.
Is another quick question: can they offer an alternative to, instead of something strong like a medicine that has an opioid base? I guess
they could. I mean, there's
definitely
you're 100% right. I mean, there are varying levels
Yeah.
of opiates. So they go from less intense, where you think of maybe like Tylenol with codeine.
Yes.
Which would be a less intensive, all the way up to fentanyl and Oxycontin and
Yeah.
things that are more intensive. So yes, the issue is that you kind of have this balance, right? And doctors struggle with this as well, and that's what the doctors are kind of going through now. In that in the 80s, 90s, early 2000s, there was a strong kind of push for doctors to be reviewed, and there was a strong push that doctors should help people and they should end pain. So the doctors really looked at it as, okay, we don't want people to suffer. We want people to feel better, so we're going to prescribe these things. And part of sort of my review and metric is how happy people are when they see me, if they leave comfortable. So that kind of started that more, it's more complicated now, but those are kind of the two big things that kind of started this opiate epidemic, where people were using these and then they just couldn't get off.
Interesting.
And like when I go to the doctor now, they say we can't prescribe Tylenol, codeine.
Yep.
And they said regular Tylenol will work just as fine as the codeine stuff that you had in your system.
Yeah, I mean, dependent upon how severe, certainly
Yeah.
you don't want people to be in pain, but you also don't want people to get addicted. So,
Right, it's a
Yeah.
balance.
Yeah, I
Yeah,
wasn't
it's
addicted.
tough.
I was just,
of course,
I was
not.
just in pain and asking for pain when they do surgery. Like right here, they did surgery
Mhm.
and get cancer out, and I want it. And but they said you can go get some Tylenol, and they do the same thing as that Tylenol codeine.
Yeah, it can definitely be helpful.
So I said good.
Yeah, exactly. Yeah. But that's the thing. You don't want to expose yourself if you don't have to.
Right.
No.
Because we've seen a lot of different people kind of come through, and you don't know what they're going to be addicted to.
Right.
You don't.
That's true.
Everybody here might have something if they tried it they could possibly get addicted to.
Okay.
So that's why you try to avoid it as much as possible.
Yeah, we need to take our break now.
We'll be right back in just a moment.
Thank you.
All right.
Back and we're journey with Don, Tez Taylor, and Tim Soko. Yes. Back to Tim.
Okay. Jason, what are some of the ways we in the community could help someone who is addicted?
So the first thing I guess I always recommend is somebody that's, knows someone who's addicted or knows somebody who might be struggling with things is to try to get them into treatment and try to at least get them to agree to an assessment. A lot of times people say, I don't have a problem, I don't have a problem, I don't have a problem. But that first step is, okay, that's fine. Maybe you don't have a problem, that's fine. But why don't you just go get an assessment? Why don't you go to your local hospital or agency and get an assessment to see what they think? And a lot of times that can be really impactful because as someone's kind of telling their story, it starts to become self-evident to them that they have a problem. We'll ask questions like, what does your family think? What do your friends think? Have you lost any friends because of it? And as they kind of go through the assessment process, there's usually some sort of recognition. Not all the way. It's not like they're super excited to get into treatment sometimes.
Right.
But there is some recognition that this is an issue, and this is something I need to address. So that's one way people get into treatment. The other way is they get in trouble. So over half of our referrals come from the criminal justice system. So somebody gets in trouble with drunk driving or a possession charge, and then they come to us, and maybe they're not super motivated, but we work with them to try to get them on board with our treatment. So I think if for people in the community, if they know something's wrong, having that conversation and having it from a perspective of love, right?
Yeah,
You don't want to blame people. You don't want to say,
What would you do if you got young people like 13, 14,
Yeah.
15, and they go and pick up a cup because they want to be cool
Yep.
and just drink it and then they get sick.
So
All because
yeah,
of this.
that's a great question.
Because I know someone little kid that had drunk some something and then he had lean in it and,
Oh, yeah,
and
yeah.
he was trying to be popular because they said he was a nerd, so he just picked up.
It's a way to kind of move forward. Yeah, I think that's an excellent question. So the vast majority of my career has been spent with children and adolescents. So I started off as a home-based therapist that went out to the home to help children and adolescents with addictions and working with the families. So I think that's a very valid question in that, what do you do with children who are struggling? Because a lot of times it's normal in a way to experiment with substances. So over 50% of high school seniors have tried marijuana. That's across the country. So, if you look at anyone graduating, about half of them have tried marijuana at some point. Do all of them need our services? No. I mean, do all of them need chemical dependency treatment? Not at all. But there's that balance, right? And a lot of times it's hard working with youth because even the ones that are struggling, say even ones that have, what we'd call an addiction issue, they haven't experienced enough of life's consequences for it to be super meaningful. Like somebody who's maybe in their 30s or 40s, they'll say like, well, my wife kicked me out, or my family doesn't want to be around me anymore. For a kid, you're not going to get that.
Right.
It's going to be things like, well, I got kicked out of school, but everybody gets kicked out of school every now and again. So it is harder. The intervention for children is through the family because you have leverage. You know, typically a child is not, you know, they don't have tons of money. I know when I was a child, you know, I didn't have much money to buy things. So
Right.
they're getting money from somewhere or from someone.
That's interesting. Right?
And then typically the younger a child is when they use, so when we do an assessment, if they say it's a 17-year-old and they're smoking marijuana, I go, okay, you know, they're probably getting it from their friends around the community, maybe they got a part-time job, maybe they're selling it a little bit on the side, maybe that's how they're getting it. If a 12-year-old comes in and says, I'm smoking marijuana, my first thing is, who in the family's using? Because 12-year-olds typically don't run in the drug circles, if you will. It's not, you know, they're not in high school, it's not kind of a common thing, it's not really a time for experimentation yet. So there's a lot of factors that go into, and I'm glad you asked that question about children and family because it is so tricky. There's a lot of questions that go into how do you treat a child, how do you treat an adolescent.
So real quickly, so then is recovery resource?
Yep, cover resources.
Okay, recovery resources. So then initially, someone would probably come in for an assessment,
Correct.
and then once they have
The
the
next step from
assessment,
there?
yes.
So when somebody comes in for assessment, they get a full assessment. Typically lasts about an hour and a half. So it's going to be questions about, you know, all kind of their major life domains, you know, things that they do. If somebody needs services, then we look at the level of care. So level of care goes along kind of a huge continuum. One being kind of lower level outpatient, meaning maybe you meet with a therapist once a week, all the way up to residential, where you have to stay somewhere to get sober because you need limited access to drugs. In recovery resources, what we just do community-based work. So we do outpatient level. So what you think of as once a week, talk with a therapist, all the way up to partial hospitalization. So that's up to 20 hours a week of groups, talking with individual therapists, and then working with psychiatrists. And psychiatrists are doctors who can prescribe psychiatric prescriptions.
And from a parent's perspective, what would you tell the kids out there from a parent perspective?
Well, I think it would be based on where I can get information. I mean, I would go to a place like Recovery Resources and then find out what information is out there so that I can pass along to my children to educate them about using drugs and the epidemic, or you know, or follow what's happening in the high schools and
Yep.
sort of be aware. I think sometimes you have to be aware, you have to be involved, and just kind of know what's going on. And then if something like that does affect my family, then I would know where to go or go seek help. Or you guys would sort of, you know, refer me someplace else if needed.
So
yeah.
I'm glad you brought that up because when we talk about children a lot in their exposure, we talk about prevention, right?
Yes.
So prevention's a huge word. You know, like we go into the schools, we talk to kids, this, that, and the other. I don't know if any of you remember, but you know, probably 20, 30 years ago, there was a program called DARE.
Yes.
Yeah, I remember that.
Yeah.
Because I was in it.
Yeah, I was in it too. So the police officer come to the school and they talk to you about how bad drugs are, this, that, and the other. What they found long term is that program was not super successful, at least the way it was implemented. And it was because, and if you think about it, it makes sense, right? Somebody who's using pretty much has heard somewhere before that using drugs is not great, but they still did it, right? So it's not a matter of education. So what we really try to do with prevention and what prevention agencies try to do it's not about just telling somebody substances are wrong. It's about linking them to positive activities.
Yes.
So making sure, so we know that people are more at risk if there's troubles with their family. We know people are more at risk if they don't have friends because, as you mentioned earlier, it's an easy way to make friends, right? You can just go right there and make friends easily. So we really try to put those protective factors around the child so that they don't get exposed to, or what I should say, because they're going to get exposed. When they get exposed to substances, they can say no, not because they know it's bad, but because they have so many other good things going on in their life.
Right.
Yeah.
So you're saying basically that just saying don't do drugs is not enough anymore.
No, yeah,
It's just putting
because everybody knows
right,
it's bad.
Right.
Yeah,
Right.
just doing it the Nancy Reagan way
Yeah,
won't work.
exactly.
anymore.
It didn't work right.
Exactly
Both
right.
Are they there in the 80s? You know, but it is. It's just like you said. You know, with positive behaviors or positive things in their life.
Yeah.
Yeah.
If you think about your own life, right? I mean, you know, when you get up and kind of do something, you're thinking about, okay, I'm excited about doing this today, or I'm excited about doing that, and this is what I'm interested in. And if you don't have that, for a lot of people, drugs fill that void.
Right.
So I think it's it's about getting people active. It's about getting people excited and passionate about a project or something in their life.
It's interesting. I like that. I like that better than saying just no.
Yeah.
Because in this day and age, it's not good
No.
enough.
Yeah.
Mhm.
Tim, next question.
Where can you go in the community to find support groups?
So it depends on, I guess, which support groups you're looking for. So there's certainly family support groups in the community. There's a natural network, through AA, Alcoholics Anonymous, Al-Anon for families. There's also the behavioral health agencies, so Recovery Resources being one, but we're just one of many kind of in the area where people can get support and reach out. I think making that first connection, so it's funny, as soon as somebody makes that first connection, they're way more likely to, less likely, I should say, to go to the emergency room after that. And that's just one visit. Just getting that first link, then people know. And I'm sure you can think of it in your own lives that it's scary sometimes trying something new. And if you have someone to help you make that first link, that first connection, that warm handoff, then you're way more likely to be successful.
That's true.
Because it's hard, right? I mean, it's hard to do something. I don't
Yeah.
want to change.
Right. No,
It's hard. It's work.
It is. And I think it's also hard to say, "Hey, I need help,"
Nope.
and
It's a big thing
to
to
make
admit.
changes in your life. I'm sure.
Yeah, we got to
difficult.
make sure that we link ourselves to the community and find them resources out there. And if you're looking for resources, call 211, and they have all kinds of health things out there for the community to find, to learn about, and they can teach you something. You can find stuff that you never heard of.
Yes. Yeah, 211 is amazing. You call that number and you talk about what you're going through, you can go right through it.
It's a good resource.
That's right. It's resources for health, everything.
Could you maybe share, Jason, a positive story of someone who went through recovery quickly?
Sure. I won't say quickly because it is.
Or
No. I'm
Yeah.
glad you asked it that way because it I guess it allows me to hit home that recovery is ongoing and lifelong. So once you have a substance use issue, it's not as if say you had a problem with alcohol and you stopped drinking for 3 years. If you start drinking again, more likely than not, you're going to get right back to where you were. So this is something that's lifelong that you really have to kind of maintain. Yes, I mean, we have multiple people every day. I can think specifically from my time being a therapist, was working with children. So seeing those connections, I can think of multiple kids who had a negative relationship with their family. They were kind of the one that the family kind of pointed at and said, "You're the one, and it's your problem, and you're the one who's causing this trouble in the family." And seeing that family kind of change their perspective, because for a kid, it's really hard to change if your family, because they're going to drag you right back in that cycle, right?
Right.
You're trying maybe not to yell or argue or whatever, but when your mom or your dad is kind of pushing at you or maybe treating you in a not kind way, it's hard just to turn the other cheek, especially when you're younger.
Right.
So I think that in terms of that, yes, I mean, we see little miracles every day. But I think the key is that there is no sort of magic like, and now you're fixed.
Right.
It's always something that people are going to have to buy into and know that I can't do that again, or else I'm going to get back to where I was.
Right.
And what can we do, and what is your phone number so people out there in the community can know where to reach you if they need this opioid or whatever help out here in our community to make it better for them and their families.
I'm glad you asked
Which
that.
brings up the question of how can the community get more involved in the fight against addiction?
So for Recovery Resources, our website is www.recres, that's recres.org. And we also have a centralized intake, meaning that if anybody calls our main line, which is 216-431-4131, again, that's 216-431-4131. If you call that number, you can immediately get linked to an assessment. We also do same-day assessments. So if somebody wakes up today and says, "Hey, look, I want to get sober," they can get an assessment that day.
Very nice.
That's
Good.
Very nice.
Yes,
You're
we
doing
thank
good
you.
work.
We thank you for coming in, giving us the insight on the opioid academic out here and
Epidemic.
academic, yeah, and stuff like that. And this been enlightening to me. I learned some more stuff that I didn't know.
Oh, good.
And all that. And you got some statistics, Tim.
Well, as Jason was saying, of a record-breaking about 727 fatal drug overdoses in 2017, 492 were from fentanyl and opioid used as pain medication, and 191 were from carfentanil, a derivative of fentanyl, which is about 100 times more potent.
Yeah, well, thank you, Jason, for explaining to us about the epidemic and what recovery resources do. And
thank you for them
yeah.
facts too. Thank you for them facts, Tim Soko.
You're
on
welcome.
What's going on? We need to know what's going on in this community so we can help.
Yeah, we can help the people who need to us to help them in the fight when these kind of fights in the community.
Yes. We thank y'all for listening to WUCP. We thank you, and we'll be back next week, and we have a great show next week and everything else. And God bless, and we hope we can help someone in our community again. God bless you.